Hey, calling all nursing students. Buckle up because we're about to speed through some renal failure trivia inspired by Nurse Chuckles. Compliments of my 2 cents community help services. Ready to test your knowledge? It's never too early to prepare for the NCLEX with ease. I've got 6 next-generation NCLEX questions focused on renal failure, or as I like to call it, the coffee filter of the body. Because who doesn't love a good coffee analogy? Let's brew up some knowledge. These questions are designed to challenge you and reflect current medical standards. Let's dive in. Question 1. A patient with chronic renal failure comes in complaining of SOB. No, not the kind of SOB you're thinking of, but shortness of breath and swelling in the lower extremities. Which complication is the patient most likely experiencing? Is it A, hyperkalemia, B, pulmonary edema, C, anemia, or D, hypertension? The correct answer is B, pulmonary edema, just like when you overfill your coffee filter. This often occurs due to fluid overload in patients with renal failure. Question 2. During the assessment of a patient with acute renal failure, the nurse notes a serum potassium level of 6.5 mQl, milliequivalents per liter. Yikes! Which of the following interventions should be prioritized? A. Administering a sodium polystyrene sulfonate. B. Restricting dietary potassium. C. Preparing the patient for dialysis. Or D. Monitoring the patient's ECG. The answer is D. Monitoring the patient's ECG. Hyperkalemia can lead to life-threatening cardiac arrhythmias. Think of it as your heart's way of saying, too much coffee. Question 3. A patient with end-stage renal disease, ESRD, is being evaluated for peritoneal dialysis. Which of the following statements by the patient indicates a need for further teaching? A. I will need to maintain a sterile technique during exchanges. B. I can perform this procedure at home. C. I will need to follow a strict schedule. Or D. I won't need to limit my fluid intake anymore. The correct answer is D. I won't need to limit my fluid intake anymore. Even with dialysis, fluid restrictions are often necessary to avoid pulmonary edema and other cardiovascular issues. Just like you can't drink unlimited coffee without consequences. Question 4. Which lab value is most indicative of a patient's renal function? A. Serum creatinine. B. Blood urea nitrogen, BUN. C. Urine specific gravity. Or D. Serum albumin. The answer is A. Serum creatinine. It is a more specific indicator of renal function compared to the other values. BUN can be elevated for other reasons such as dehydration. Think of creatinine as the espresso shot of lab values. Question 5. A nurse is providing dietary education to a patient with chronic renal failure. Which dietary choice would be most appropriate? A. Grilled chicken with steamed vegetables. B. A baked potato with sour cream. C. A spinach salad with nuts. Or D. A cheeseburger with fries. The correct answer is A. Grilled chicken with steamed vegetables. This option is low in potassium and phosphorus. Think of it as the decaf option. Question 6. A patient with renal failure is prescribed erythropoietin. What is the purpose of this medication? A. To lower blood pressure. B. To stimulate red blood cell production. C. To reduce potassium levels. Or D. To increase urine output? The answer is B. To stimulate red blood cell production. Erythropoietin is used to treat anemia commonly seen in renal failure and can be given intravenously or subcutaneously. Think of it as your body's way of getting a caffeine boost. That's it for today, folks. Remember, practice makes perfect, and a little laughter never hurts. Keep reviewing, stay focused, and you'll ace that NCLEX with a smile. Don't forget to like, subscribe, and hit the bell for more helpful content. Be sure to get in touch with Harriet and Nightingale's protégés to take advantage of our low-cost NCLEX review education and digital downloads at your request. Good luck out there. And remember, laughter is the best medicine.